Nepal, a country in the lap of the Himalaya, is geographically, ethnically and socio-economically diverse country. Of its nearly 30 million population, 1/4 are living below the poverty line of less than $1 a day. Nearly 3.5 million Nepalese are considered food insecure. Yet, despite all these challenges and constraints, Nepal has made significant progress in health indicators and is on track to reach the MDGs 4 and 5. Nutrition interventions, especially micronutrients, have been a major contributing factor in reducing child mortality. The key to this success has been the movement towards decentralization and the presence of strong community-based structures. About 50,000 female community health volunteers all over the country have helped to save lives of children and mothers by delivering basic health and nutrition services.
In the area of micronutrients, we've done very well. Our vitamin A coverage has consistently been 90%. Iodine distribution to households has remained at 80%, which is very encouraging. And iron supplementation to pregnant and lactating women has been 80%. As a result of these successful public health programs, anemia prevalence in children has reduced from 75% in 1998 to 48% in 2006, and there has been a slight slower decline, and now in 2011 we are at 46%. So we have to do slightly more in this area. The situation of chronic malnutrition in children is not so good. 41% of our children are still stunted, 29% underweight, and 11% suffer from acute malnutrition.
Although the problem of undernutrition is pervasive across Nepal, national aggregates mask-wide disparities across socioeconomic groups and ecological reasons. This threatens to derail the progress made in cutting child mortality in the past decade and calls for radical efforts. A 2009-2010 nutrition assessment and gap analysis called for a building of a national nutrition architecture and a multi-sectoral approach to tackle malnutrition effectively and sustainably.
The consequences of chronic malnutrition affecting nearly half of children in Nepal are profound, irreversible, and lifelong. It leads to increased disease burden, increased risk of death by about 1/3. It also diminishes learning ability, reduces economic productivity, and leads to high risk of chronic diseases later in life. In sum, this all ultimately translates to a loss of up to 3% of the country's GDP. The most affected children are from the poorest and marginalized segments of society. And this really we cannot tolerate, especially when we understand the causes of malnutrition and know well that the solutions are feasible and highly cost-effective. I'm very pleased to note really that now in Nepal, various partners are coming together in what we call the Nepal Nutrition Group. This involves the UN agencies, the donors, and the civil societies. And the National Planning Commission is leading the most recent high-level nutrition and food security steering committee, which includes all the key sectors. This is very important. It will ensure that we all work together in a coherent, coordinated, efficient, and effective manner. It is the only way we can root out chronic malnutrition from Nepal.
In the past months, extensive consultations through reference groups formed by the National Nutrition Steering Committee have been held to discuss evidence-based sectoral nutrition reviews for possible replication and adaptation in the country. This has led to drawing up a multi-sectoral plan of action to reduce chronic malnutrition with a focus on the critical window opportunity.
National Planning Commission is a national architecture for nutrition, and it is leading to develop the multi-sectoral nutrition action plan. In this regard, the costing and the detailed plan of action work is undergoing. And just recently, we have formed a high-level nutrition and food security steering committee under the chairmanship of NPC Vice Chairman. Besides that, advocacy, coordination, and other works are underway by National Planning Commission.
The Ministry of Health and Population plans to maintain the achievements made in micronutrients programs, scale up essential nutrition actions including promotion and protection of infant and young child feeding through community-based programs linked with multiple micronutrient powders distribution for 6 to 24 months children, integrated management of acute malnutrition, zinc in management of diarrhea, and programs to improve maternal nutrition. The Ministry of Local Development will play a key role to streamline nutrition architecture at the subnational level and to scale up social protection schemes that support nutrition. Similarly, other sectors including the Ministry of Physical Planning and Works, the Ministry of Education and the Ministry of Agriculture and Cooperatives are all working to include nutrition considerations in their sectoral plans. Foundations are being laid for the decentralized implementation and scaling up of the multi-sectoral nutrition plan through regional and district level advocacy and sensitization. The remaining critical factors to success will need to be fully addressed. Nutrition capacity building at all key levels, ensuring the continuous functioning of the nutrition architecture, introduction of a suitable information system with core multi-sectoral nutrition indicators for tracking progress, and finally continuous advocacy and communication to sustain commitment for scale-up of nutrition.
Undernutrition is one of the biggest challenges in development. We are by now well aware that it's a major problem in many developing and certainly even more important in the least developed countries. We have already established the fact that if we could wipe out undernutrition and malnutrition, we would automatically obtain a 2 to 8% increase of the GDP without any other additional measures. At the same time, we know that malnutrition and undernutrition can be attacked. It can be treated. And this makes us being so interested as donors, together with all the other major donors, that we have established already the link between malnutrition and underdevelopment. For this reason, the European Union has granted 20 million euros to UNICEF to be dedicated to 5 Asian countries, including Nepal, with the purpose of combating undernutrition and malnutrition. Maternal and young child nutrition security will attract 3.2 million out of this funding for Nepal only. The project deals with a window of opportunity, which is the first 1,000 days of the child, from the conception in the mother until the child completes 2 years old. And this is the period that this program and project is attacking. The project is very important as capacity building for central government staff, for district officials, and for local government. And it is even more interesting because it is the first time we have a multi-sectoral approach where several ministries are contributing and participating in this program under the coordination of the National Planning Commission. We want to see the results in Nepal of this multidisciplinary and multi-sectoral approach, hoping that they will be very positive and that we will draw lessons, also best practices for other parts of the world as well. The European Union delegation to Nepal has decided to put this project in the heart of our portfolio, as we believe it is really important and worthy.
The government of Nepal is committed to eliminate chronic malnutrition through decentralized and phased rolling out of multi-sectoral nutrition plan. Nepal looks forward to continued fruitful collaboration and support from all UN agencies and external development partners. And the time for action is now.